Hello class, this will be a video demonstration of facet joint orientation in the spine and how it influences movement in the spine. So we are going to start with the OA joint. At the OA joint, we have the articulation between the occipital condyles and the superior facet of the atlas. The occipital condyles are going to be convex, and the superior facet of the atlas is going to be concave in the sagittal plane, allowing for that nodding motion of flexion and extension. So we've got that upper cervical nodding happening at that joint. C1 on C2, our atlantoaxial joint. This one is going to be where the atlas will move around and rotate around the dens or the odontoid process. So what we have happening at this joint is rotation. As the atlas rotates around the axis or around the dens, this is where 50% of our rotation is coming from in the cervical spine. As we move into the rest of the cervical spine, these facet joints are going to be oriented 45 degrees off the horizontal plane, allowing for motions in all planes. So we get a lot of rotation happening. We get flexion and extension happening as well, and we also have side bending. So with flexion and extension, the facet, the inferior facet of the vertebrae below is going to move up and forward on the superior facet of the vertebrae below. With extension, the inferior facet of the vertebrae above is going to move down and back on the superior facet of the vertebrae below. With rotation and side bending, these motions happen at the same time. And what we will see is as we rotate to the right, this left side will move down and back. This right side will move up and forward. So that's what we see happening at our facet joints with side bending and rotation coupled in the same direction. As we move down the thoracic spine, this is that transition area. The upper thoracic spine will begin a little more in the horizontal plane. As we move into the mid-thoracic spine, these are going to be predominantly in the frontal plane. Lower thoracic spine are going to start to become a little more in the sagittal plane. So our typical thoracic spine segments are going to be primarily in the frontal plane. So that will allow for lateral bending, but our side bending is also going to be limited here by our ribs. So our ribs are going to block some of that movement. Upper thoracic spine, we're going to have a little more rotation. Lower thoracic spine, we're going to have a little more flexion and extension. When we get to the lumbar spine, these facet joints are going to be oriented predominantly in the sagittal plane, allowing for flexion and extension. They will side bend a little bit, and they will also rotate, but very little. Because as I try to rotate in this direction, this facet joint compresses, this side gaps. As I side bend, this side goes up, this side goes down. And there's not a lot of room for that to happen. So predominantly what we have in the lumbar spine is going to be flexion and extension. And then the very last segment, L5 on S1, that facet joint will start to become more in the frontal plane. And that is to prevent this L5 vertebrae from slipping down and forward on the sacrum. So that vertebrae is in, or that facet joint is going to be kind of back in the frontal plane. I hope this helps.